Hi, my name is Dr. Alistair McAlpine, and welcome to the inaugural episode of my long format videos, which hopefully will publish on YouTube, and from that there'll be a podcast that will come from this as well. So basically the aim of these long format videos is to do a little bit deeper dive into hormonal health, longevity, biohacking, unpack certain questions a little bit more, just to give you a bit more of an in-depth understanding basically of various aspects of hormonal health and longevity. I must mention from the word go that I'm very proud to be bringing this long format video in partnership with AndroLab and FemLab, and I will link them in the description below. They're both online platforms, which I am involved with. However, they are fantastic because it's online. So everything is done completely from the comfort of your own home. No doctor visits, no clinic visits, no having to stand in pharmacy queues to get your medication or your therapy, all delivered to your doorstep on a monthly basis with continuous medical guidance supplied by me and the rest of the medical team at both AndroLab and FemLab. So I will link them in the description below. Go check out the websites, pop a message in the comments if you want to ask any questions about that. All right, so the topic today that I want to discuss basically is around testosterone. However, what I really want to focus on is the effects that testosterone has on various tissues within the human body. So to understand, you're taking testosterone therapy, you've been told that you're a candidate for testosterone therapy or testosterone optimization therapy. What are the benefits actually of using testosterone? How is it going to help you? Which tissues basically is it going to work on? So that's sort of the point of that we're trying to get across today. So you get a better understanding that if you are using testosterone, these are the potential benefits that it has to the human body in terms of which tissues of the human body it acts on. So basically, you need to look at testosterone as the conductor of an orchestra. So not only does it help with certain things like libido and fertility and muscle mass, a whole bunch of other aspects of the human physiology that it addresses as well. So it's basically the conductor of the orchestra that's going to make sure that your body's physiology works in harmony, that everything's working well together. So it's just important to remember that point from the word go. So the first physiological anatomical system we're going to start with is musculoskeletal, so namely the muscles and the bones. So how does testosterone affect muscle? So testosterone, as we know, has an anabolic component, meaning that it rather builds up than breaks down. So in muscle tissue, basically testosterone binds to various receptors inside the cells, which then allows basically production of new proteins. These new proteins then allow to thicker, stronger muscle fibers. So basically helps with building a muscle, so muscle hypertrophy, but will also help with endurance and reducing the risk of injury. And if there is injury, improving repair after injury. So basically improved recovery. When you go to the gym and you do weight training, what you're doing is you're actually creating micro tears within the muscles. And these micro tears then obviously need to repair. So if you find that your testosterone is low or suboptimal, your body's not going to be able to repair this tissue adequately. So this is one of the key factors where testosterone works really well. Helps to synthesize new proteins through amino acids basically, which then allows to build more healthy muscle tissue. But remember, it's also not just about the gym performance as well. Muscle's also a metabolic organ as well. So it helps to regulate blood sugar and insulin sensitivity as well. So obviously the more muscle that you've got, the better your glucose control will be. So with testosterone, doesn't only improve muscle mass, but also actually helps to prevent diabetes as well and improve your metabolic drive. It increases your basal metabolic rate. What do I mean by basal metabolic rate? Basically, when you're sitting like I am now and you're not really doing too much activity, what is my body burning in terms of energy sitting at a basal level? So obviously, increased basal metabolic rate means that you're going to burn fat, you're going to burn excess carbohydrates far, far easier than if you don't have an elevated basal metabolic rate. And this is linked to, obviously, muscle. When you come into bone, so bone is basically controlled by cells called osteoblasts. So basically, the osteoblasts are responsible for building new bone cells. Once again, this is also stimulated by testosterone. So optimize testosterone levels, easier to lay down new bone, but also help increase the density of the bone as well. This becomes very important as we age, because we know as we age, there's something called osteoporosis that creeps up on us. And if you look at where patients get older with lower testosterone or suboptimal testosterone levels, we find that these patients now land up with osteoporosis. So this is where testosterone is massively beneficial. So remember, sometimes low testosterone levels, your bone density is going to start decreasing, and this is when obviously fractures become more likely. So that's why we see increased rate of hip fractures in geriatric patients. So that's another benefit of testosterone, helping to build new bone. So remember that also this applies to female patients as well. Very important. Low testosterone, vitally important for female patients to also basically ensure healthy bones. So next aspect we move on to, blood and bone marrow. So this is slightly different to obviously just talking about the musculoskeletal system. We're now looking basically the inside of the bone, all right? So deep inside the bone, you have bone marrow. So testosterone also plays a role here as well. So testosterone helps stimulate the production of red blood cells. So this is a process called erythropoiesis, basically. So increased production of red blood cells. Remember, red blood cells are carrying oxygen, right? Oxygen vitally important for fueling your brain, fueling muscles, and every other organ actually in your body. So this is why men always tend to have a slightly higher hemoglobin than female patients, because we've got higher levels of testosterone. But what's important to note here is that this is where if your testosterone levels are too high, so you're doing testosterone optimization therapy or replacement therapy, and there's no adequate medical monitoring and your levels are too high, you can actually increase the red blood cell production too much, which can cause slight thickening of the blood, which can then lead to some other downstream issues. So this is where it's always important to remember that if you are doing any form of testosterone therapy, to ensure that your bloods are being monitored, that you're at that physiological high value, not at super physiological levels, because you want to ensure that your something called your hematocrit, so your body's potential to produce hemoglobin, red blood cells basically, is not too high. Otherwise, this can lead to further issues down the line. We're then going to move on to the brain. So yes, testosterone definitely controls or has an effect on the brain. So namely mood, motivation, and memory. So when we look at testosterone's role in the brain, it's quite fascinating here. So in the hypothalamus and the amygdala, this is basically the brain's emotional command center. Testosterone helps to shape and drive motivation and competitiveness. So this is where testosterone has a positive effect in these areas of the brain, and this is why you get that feeling of most motivation, drive, wanting to succeed, wanting to be good at what you're doing. This is where testosterone plays a very important role. But not only just from a motivational point of view, but from a cognition point of view as well. So things like spatial awareness, verbal memory, and problem solving have also actually been shown to be improved on patients that are receiving testosterone optimization therapy. And what's quite interesting now as well is there's this big concern now, obviously, in terms of, and it's becoming more and more popular in the literature now, is around things like Alzheimer's. So there's some really interesting studies that are coming out now that's showing that testosterone therapy done correctly can actually have a neuroprotective effect as well. So decreasing the risk of Alzheimer's and dementia later on in life. Once again, we see this correlation with the geriatric population, with older patients. Low testosterone levels, we find that this is when they get hit by things like Alzheimer's and dementia. So just something important to remember. And then mood. So there's this big misconception that patients feel that if they want to increase or optimize their testosterone levels, they're going to become more aggressive. This is actually completely incorrect. Low testosterone is often linked with fatigue, irritability, depression, and even aggression. So we find that if we optimize your levels, you might find complete mood improvement. That ability to cope with stress is far better. Decreased anxiety, decreased depression. You just feel better, but once again, done in a controlled medical environment. Also, testosterone interacts with various neurotransmitters as well, like dopamine and serotonin. These are the cells that, or the neurotransmitters rather, that are important for motivation and happiness. So obviously now by upregulating this, guess what's going to happen? You're going to feel better. So very, very interesting in terms of the effect that testosterone has on the brain. Now, fat and metabolism. So if we look at the role that testosterone has on adipose tissue, which is fat, very, very interesting here. So higher levels or optimized levels can promote lean muscle mass, right? Which then reduces visceral fat. Once again, going back to what we're talking about in the musculoskeletal effects that testosterone has, by increasing your basal metabolic rate, it's easier to basically burn fat. So we see now subcutaneous fat decrease as well, and visceral fat can decrease as well. So you find the patients now that have got lower levels, and we see this in obese patients as well, sometimes they've got very low testosterone levels. And this is why it's very difficult sometimes for these patients to lose weight. So even if you're now using a GLP-1 medication and the patient may not be responding as you want with this GLP-1, it's quite important then to maybe turn around and say, let's test your hormones and see where you are, because by immediately improving their testosterone levels, that's when you find that these medications, the GLP-1 agonists, work far, far better as well. So important correlation here between obviously optimized testosterone, increasing basal metabolic rate. End result is helps to basically burn more fat, decreases visceral fat. So visceral fat's the fat around your organs, which obviously leads to a far healthier physiological picture. Okay. So skin and hair. So a lot of people are also concerned that if they can use testosterone, they're going to find, oh, I'm going to get acne or skin breakout. So how does testosterone impact this? So on the surface, testosterone makes itself visible through the conversion of something called DHT, dihydrotestosterone. So some patients are more prone to this than others. So basically, if you look at what dihydrotestosterone does, is this actually leads to sort of pubertal changes that you see in younger male patients, where they get deepening of the voice, start to grow a bit of facial hair. This is sort of driven by the whole DHT process as well. But this also acts on glands within the skin called the sebaceous glands. So the sebaceous glands can lead to acne if there's increased production of sebum basically from these glands. So what's important to remember here is, once again, and I'm going to go back to this point, that you can actually see benefits in hair, skin, and nails basically if you are optimized correctly. So a big concern that patients have is they feel that if I start testosterone therapy, I'm going to lose my hair. If your levels are too high, then yes, especially if you're one of those patients from a genetic component is more prone to DHT, then there is a possibility you may lose hair. But once again, if the levels are too high, this is where medical monitoring is important. Keeping it at that physiological high value, making sure the levels are good. You shouldn't lose hair. If anything, I've had patients of mine that have reported improvement in hair growth, improvement in skin quality. But once again, monitoring them, making sure that the levels are perfect, spot on, and this is where you get the benefits from it. So in terms of the reproductive system, so here's another interesting system to talk about basically when it comes to testosterone therapy and the benefits of testosterone in these systems. So testosterone drives a lot of components. So in men, basically, testosterone is essential for something called spermatogenesis. So this is the process of making sperm. So it helps with fertility. So basically, this works hand in hand with cells called the Sertoli cells, which are found within the testes. And this ensures adequate sperm production, which is obviously going to be a key component with fertility. However, it's important to note at this point that with any exogenous testosterone, what do I mean by exogenous? Testosterone that's been administered either within the form of an injection or a cream, there may be slight down-regulation of fertility, because you get down-regulation of something called the hypothalamus pituitary gonadal axis. So basically, it's something called the negative feedback mechanism of the brain. So always warn patients that are starting these type of therapies, you're going to probably see down-regulation. Once again, if your level's in the physiological high value, so it's been monitored correctly, you're not going to get complete shutdown of sperm production, but you might get slight down regulation. This is very, very important to mention. And this is where adjunctive medications can help as well. So it's important to talk to your doctor, get an idea of what can you do to preserve fertility. If you've got suboptimal low testosterone levels, what can I do to make sure that basically fertility is maintained if that is a concern for you. Also, overlooked in female patients as well. Testosterone, vitally important for female patients for libido, energy, overall vitality as well. We see that female patients who have got fatigue because their testosterone levels are low, immediately the libido is going to be low. So it's important also for female patients driving basically libido process as well. Then the cardiovascular system. Once again, big misconception around testosterone in the cardiovascular system. And a lot of patients think if I use testosterone, I'm basically going to increase my risk of having a heart attack or a stroke. This is completely incorrect as well. So testosterone actually acts as something called a vasodilator. So increases the production of something called nitric oxide, which basically helps to dilate the blood vessels. So this helps to actually improve circulation, which is obviously very, very good for heart health as well. And it's also been shown that testosterone from a lipid profile point of view, so your cholesterol, once again, if done correctly, can actually increase HDL, which is obviously good cholesterol, and lower LDL, which is your bad cholesterol. But once again, here's the paradox. If your levels are too high, you're not doing it under medical guidance, this is where you can actually get worsening of cardiovascular health. So very, very, very important to make sure that when you're doing these things or when you're doing testosterone therapy, it's being monitored correctly to ensure that your levels are right. And you can also even check your lipid profile as well. But just if your levels are done correctly, you shouldn't have any cardiovascular issues. There's no increase in cardiovascular risk and actually benefits to your cardiovascular health. So just to wrap up, where does testosterone work? We see it works pretty much everywhere. The muscles, the bone, blood, brain, metabolism, skin, hair, reproductive tissues, and even the cardiovascular system. So it's not just a single purpose hormone, it's a whole body regulator. It's the conductor of the orchestra. It's going to make sure that your body's physiology works in complete harmony to achieve optimal health. So as you get older, starting to see the symptoms potentially of low testosterone, or you feel that your levels are low, the best way to confirm this is to get a test and do it correctly. Platforms such as AndroLab and FemLab, this is obviously easy to do, can be done through the comfort of your home. We're going to check your blood levels, going to ensure that you are receiving optimal treatment based on your bloods and your medical history. Once again, driving home the message about the importance of correct medical guidance to ensure optimal outcomes. Anyway, that's the end of my first long format video. I hope you found this video to be interesting. It's the first of many to come. Please, if you see this on YouTube, I'd like you to please like and subscribe and share. And actually on any of the platforms, please share this video with anyone that you feel may find this information beneficial. If you would like to comment on anything or ask any questions, please put in the comment section below and I'll get back to you as soon as I can. And thank you for staying to the end and listening to my long format video. And please look out for some more in the future.